Okay. I got a cold again yesterday, and I believe that being sweating out in the hot and then coming in the air condition, which I did yesterday, I came home, boy, I just wanted to lay down and sleep. And my throat started feeling funny. My wife's had it for a while. I don't know if my mom still has it, yeah. But yeah, so I took aconite last night and went to bed. I feel better today, but I just still feel tired. So, and I believe everybody's out in that hot, sweating, and then we come into a cool room. I believe that's what's happening. So, today's three medicines because two of them are not proven enough. Asclepius Vincentoxicum, which is swallowwort. That one, I'm going to just read a little bit. Asclepius vincentoxum is a gastrointestinal irritant. So any kind of gastrointestinal stuff, this medicine would be good for. And they know that by people taking in swallowwort, uh, Asclepius vincentoxicum, taking that in internally, and then they would get these irritated gastrointestinal stuff going on, producing vomiting and purging. The medical part, that's folklore. So that's from people actually eating it, and that's how they got the idea of what it does to the body. And whatever it does to the body, don't forget, homeopathically, it will repair. So if someone has gastrointestinal stuff and they're vomiting and purging, from all ends, you would consider Asclepius vincentoxicum for them. Asclepius vincentoxum is useful in dropsy, which is fluid retention, diabetes, great thirst, and there's always great thirst with diabetes, profuse urination. That also happens with diabetes. So this could be a diabetic medicine that can be indicated for somebody, especially if they got gastrointestinal stuff going on. And then the next one is Asimina Triloba, which is American pawpaw. And like it's September and I'm going to be picking pawpaws soon. Hopefully. I seen one. I don't know the rest of the forest. I don't know how it is. But as Asimina triloba, the Annonaceae, that's the type of, it's part of the magnolia family, is basically what it is. From eating the, and not, this is, they're getting it again, this is folklore, eating the unripe fruit, 5 children developed high fever. So obviously it's good for anybody having high fever, sore throat, and a scarlet eruption, which is just a rash on the body, with diarrhea, and one of them having eventually a carbuncle. A carbuncle is a sore that has pus in it, basically. So Asimina, and so you can see it's good for, so if you have a flu that has a high fever, sore throat, and skin eruptions, you would consider Asimina triloba or American pawpaw. Let's see, Asimina triloba has been also been proved, and the mouth, throat, and stomach are irritated. So it has been proved, but not a whole lot. They drink much, desire for ice cold things, and worse after eating. So this desire for ice cold things, some people with a sickness would want warm things. So this one that needs Asimina triloba, which is American pawpaw, they would want ice cold things, and it's worse after eating. So the mouth, throat, and stomach irritation is worse after eating. Produces a series of symptoms much like scarlet fever, sore throat, fever, vomiting, scarlet eruptions, tonsils, and submaxillary glands in the mouth enlarged with diarrhea. So the glands, the tonsils, and the submaxillary glands, and if they're enlarged for any reason, you would consider Asimina triloba. Fauces are red and swollen. That's more throat stuff. Face is swollen. Desire for ice cold things. They have hoarseness. Hoarseness is a 3 on this. It's a big one. So this could be a good one for my mother, with the hoarseness. So yeah, I'm not saying it is, but they're languid, drowsy, and irritable. So they're just tired. you know, and that sounds about right. And being in this area, God always places the plants you need. Having this pawpaw with these sicknesses that are going around right now, this could be one that's considered. So now we're going to get into asparagus. So the other ones were good for mouth. Triloba, Asimina, Triloba is good for hoarseness, scarlet fever type eruptions, sore throat, fever, vomiting, uh, all gastric type of stuff, swollen tonsils, swollen face, swollen submaxillary saliva glands, submaxillary glands. And then the other one, Asclepius Vincentoxicum, is good for any gastrointestinal and diabetes and things like that. Great thirst and profuse urination. Now, why aren't these bigger? Why, they're not a main remedy. I undoubtedly don't have it, but I can make a remedy out of the pawpaw, bring it in, and what's it made out of? Unripe fruit, green leaves, and the bark and the root. So it's made from all that. They take all parts of that and make the medicine out of. And I can do that. I can make that medicine and make a homeopathic medicine out of the pawpaw plant tree. Okay, so we're getting into asparagus. Folklore, asparagus has a marked and immediate action on the urinary secretions, is well known. Okay, and think about it. You eat asparagus and your urine smells like, what's it smell like again? It's real strong, anyways. Like other liliaceous plants, so that's the category of plants it's in with, just like pawpaw was in magnolia family. It acts on the kidneys, heart, and dropsical effusions. Dropsical effusion is just retention of fluid. Um, so kidneys, heart, and any kind of fluid retention. So, Asclepius Vincentoxicum, swallowwort, was good for what? Diabetes and stuff like that, urinary problems. Asimina triloba, which that all got wiped out when I picked it up. American pawpaw was good for sore throat, throat. What the heck was it? Stomach, throat, enlarged tonsils, enlarged saliva glands, diarrhea, all kinds of throat stuff with a hoarseness, and also gastric for this Vincent toxin. Okay, asparagus, burning in urethra after urinating. So they urinate and they get this burning pain in the urethra. Severe coryza, violent sneezing. So all kinds of mucus coming out with a lot of very violent sneezing going on. Whitish fluid from the left nostril, and then actually when I read, if I get to reading it later, it says, and then the right nostril. So it alternates. But it's a whitish fluid, so it's clear. It's not green. It's not so green's usually an infection, stuff like that. This one's whitish, so whatever flu, cold, whatever's going on, they've got this whitish fluid. It could be a hay fever, an asthma, um, allergy, something like that. Dropsy. So dropsy is just a fluid retention. Rheumatic pain. So they got joint pains going on. Cardiac depression with dropsy. So, the heart is affected and it's got a lot of fluid retention. So, this fluid retention can be in the joints, it can be in the heart, it can be in different parts of the body. So, and a lot of this fluid retention will give you that rheumatic pains. All right. The mind, they have anxiety with palpitations of the heart. So the heart's palpitating and they have anxiety either over it or anxiety about life, which causes the palpitations. They're ill humored. They're not very happy people. Calmness of mind. Even though they have this anxiety, they're still calm in their mind. They just have a quiet anxiety going on. Sensation of fullness in the abdomen with pinching in the umbilical region. So right around the belly button, they get this pinching pain, sensation of fullness, and it's painful to touch. So, you touch your abdomen, any touch of the abdomen is painful to them. They have flatulence. Rheumatic pain in shoulders, especially left. And it says the acromonium, which is the there's a part up there that they get pain there, and it shoots down into the back of the shoulder blade and down the arm. So especially on the left side, and that would coincide with the heart stuff going on. Feels like something passes through the kidney to the vertebrae. So from that kidney, they get a pain. It goes, feels like it's going into the vertebrae. Oppression, especially when writing in the chest. Now I don't know why writing gives them oppression. Is oppression? Feels like there's pressure on the chest. Uh, is that the anxiety? What they're writing? I don't know. Dyspnea, they can't catch their breath. That's what dyspnea is. Worse for motion and going upstairs. So any motion going upstairs, they have a hard time catching their breath. So there's a lot of lung, heart, and uh, fluid going on with this burning in the urethra. Sorry, I was trying to say a lot of oppression in the chest, pain in the shoulders, and that pain in the shoulders can be the heart stuff. Anxiety of palpitations. A buddy of mine that just died, he used to coach my kids baseball, and he one time we were at a funeral, and he said he had a pain in the back, between his shoulder blade on the left side there. And he said, man, I went to that'll pass. It's just, I probably pulled a muscle or something. Well, he went to the doctor and he had a slight heart attack. So anytime you have a pain between your shoulder blade back there, there's some heart issues going on. You need to get it checked. Or I would take I would look up and take me the proper medicine. Now I can take tinctures of hawthorn berry, which I'm working on making now. I've got a bunch of hawthorn berry right now, but you know any kind of food for the heart, like hawthorn berry and a few other ones. Let's see. So oppression. So going upstairs, they can't catch their breath. Severe shooting pain in the right side on sitting. So in the chest, they have this severe shooting pain on the right side, and they have hydrothorax, which is inflammation and fluid buildup of the lungs. Starting and tingling in the eyes, nope, nothing in the ears. So as you can see, there's a lot of heart pains, chest stuff, and with anxiety and all that going on. Uh, and a lot of fluid retention, which, all this is basically related. Paleness of the face, increase of heat in the face. Cheeks are burning. So they have a burning sensation, even though their face is pale. And I don't doubt they get red cheeks from this burning going on. Whatever's going on in the stomach, in the heart, in the chest, there's burning going on in the face from all that. Menses continue a day beyond usual time. So I don't know how many women's menses are. It happens this day and it's ended that day. This says it continues an extra day. I don't know if you can. Most women can tell that. I'm not sure. Thirst is increased. So that's all you get with the food. So they just got a lot of thirst going on. Even though they're retaining fluids, they're still thirsty and drinking a lot. Aching in forehead and root of nose. That's probably to do with that coryza coming out with that violent sneezing. They got something going on up there. Morning migraine with scotoma. Scotoma they can't see. Their vision's bad. Uh, there's like a part of their vision missing is what it is basically. But they have this migraine when they wake. Palpitations with oppression. That's a 3 in the heart. So a big heart remedy is this asparagus. You don't think of asparagus as a heart remedy, but could be a good tonic for the heart, I would imagine. Shooting pains after a meal in the heart. So they eat, and I noticed that, if I, depending on what I eat, I get gas. If I get gas and that gas puts pressure on my heart, and I get them shooting pains up in there. And a good fart always helps that. Sorry. Agitation and anxiety. There's that anxiety with palpitations of the heart going on. So they got all this agitation in their life and anxiety. They need to calm down. This week I'm going through tapping. Tapping, these are shiatsu pressure points, and you tap these and, say, what are they? Affirmations like, I first you'd say affirmations that this is causing me anxiety, this situation is bad, this situation, and you basically keep going, and I know this situation will clear up, but this is, you're confessing how you're feeling. And then after you confess how you feel, then you're going on to, um, you talk about, but this will work out. This is all going to be good. Everything works out to good for me. For me, for good to those who love God. So, anyways, I'm going through a whole tapping series this week. Uh, Nick Otner, right? Yeah, I think that's his name. Um, Tapping series. It's on Facebook and that. If you see it, I think it's going to be an hour or two a day. Just pop on your phone, listen to it. But I'm going to sit down and I'm going to go through this because tapping is worse. And the real big one is if you have a low testosterone, you want to do testicle taps, which is just slightly tapping your testicles. That pulls out the testosterone and will help you there. But this one's for melatonin, bring up your melatonin for sleep. So there's a lot to that. Let's see, frequent urination with fine stitches in urethra. So there's little stitching pains, and what did it say? Burning. Painful to touch. Where is that? Burning. I thought there was a burning coming. Oh yeah, burning in urethra after urinating, and this says fine stitches in the urethra, and they got frequent urination. They're always drinking, they're retaining water, but yet they're still urinating a lot. Cystitis with pus. So a lot of women and everybody knows what cystitis is. Feels like foreign body in urethra. So there's a lot of urethra stuff, a lot of heart stuff, a lot of rheumatic stuff going on, and there's that anxiety with the heart stuff there. Uh, but they a lot of fine stitches burning in the urethra after urinating, uh, frequent urination, cystitis, foreign body in urethra. That feels like it. Something's in there. Uh, Frequent pain in back. Oh, sorry, frequent. I'm looking at frequent rheumatic pain in back. So there's that rheumatism again, and it says dropsy rheumatic pain. So the dropsy, that fluid retention, can also cause you to have these rheumatic pains. So rheumatic pains in the back, and I don't doubt in the joints. Pain as dislocated in hip joints on the right causes lameness. So anybody having sciatica or dislocation feeling in the right joint, you you'd be surprised that if asparagus wouldn't help that out. Shootings in the knee. So anybody having knee problems at night, especially the left, cramps in calves. So someone having cramps in calves, knee pain, maybe a right lameness in the hip joint, and any kind of other rheumatic pains, you would consider asparagus for that. There's a probably a handful, maybe a dozen remedies that probably have a lot of that similar rheumatic pains and dislocation and that. It could be a dislocation on the left joint. So then you'd eliminate that one, and if it's the right joint, and asparagus would be still in the running. And then you got the knee pains. The one might be a right knee pain. This is a left knee pain. And then the cramps in the calves. I know for cramps in the calves, calcarb is a big one for that, and a few others, of course. Uh, let's see, great oppression on breathing. So, this chest stuff, the oppression, especially writing. I don't know why writing does it. It must be the anxiety and dyspnea and that. But in the lungs, they have this great oppression. They cannot get their breath. They have dyspnea, hard to catch their breath. Frequent, and then that's why the motion, any motion walking upstairs or up a hill or something, that causes them major problems. Frequent sneezing. Hawking with inclination to cough. So there's a lot of sneezing with inclination to cough. And I know like arsenicum has burning and it has the sneezing. So that would probably be one when you look this if this was the center of your case, you would look up the sneezing and the hawking and the coughing and all that, and you might have arsenicum and asparagus and a few other ones. And the mucus can't detach the mucus, so it's a thicker mucus there coming up out of the throat. Even though you have mucus, and you'll have this a lot with a lot of medicines, they'll have like a whitish fluid coming out of the nostrils, and this one says the left nostril. So that even narrows it more, and that's what you're looking for, to narrow things down. The left knee, the left nostril, the right hip. This helps you to narrow it down to be able to eliminate medicines and go right to one that'll work. But this mucus is very thick coming out of the throat, and it's probably got, I don't doubt they have postnasal drip going down there, and that's causing it thicken up in there. But you have the whitish fluid and the thick mucus they're hawking out of their throat. Excitation of sex appetite for a male with dartings in the glands of penis. So there's pains in the penis again, and they got a great excitation of the sex appetite. Taste is sweetish, like a coppery taste. Saliva is mixed with blood. Is that right? Yeah, I think that's, well, anyways. So they have blood in their, they have a sweetish taste and blood in their saliva. I think what I just read is it isn't the blood in the saliva, it's as though there's blood. I don't know. Some of these things that he writes is a little, you have to interpret it because he's basically, he wrote, this is his first edition I'm going through, and I'm going to get his fourth edition and go through that. But there's some mistakes and some different things. Coryza with profuse thin fluid, and that's what I'll be teaching out of with everybody, is the fourth edition. If people come into my community, we'll go to the fourth edition and we'll go with that. Coryza with profuse thin fluid, so that's that whitish fluid coming out of the nostrils. Bilious diarrhea, which is just watery diarrhea with pain, excoriating anus. So it's burning the anus, basically. They have colic and dragging in the groin. Now, this is a big urine remedy. And of course, it's like I said, when you eat asparagus, your urine smells like, I don't know what it smells like, but it stinks. Loaded with phosphates. There it is. That's probably what it is. It's the phosphates and the urate and the ammonia. It smells like ammonia. That's what it smells like. So anybody that would have that with a cold, a flu, or whatever's going on with them, and their urine smells like ammonia, you would definitely, asparagus would definitely be one to consider big time. And they have kidney dropsy. All this ammonia and phosphates and that is in dropsy. That's retention of fluid in the kidneys. Gravel in small quantities, so they do have some sediment coming out. Straw colored urine becomes turbid, which is real dark. So it starts out straw colored, eventually turning turbid. I don't know if it's, this is throughout the sickness, as the sickness gets worse, with white specks and flakes. Now that's very unusual. I haven't heard that in, I don't think, any other medicines, but they have white specks and flakes in their urine. That would definitely get you to asparagus. The urine can be brown, which is that turbid, or clear with fetid smell. And that fetid smell is, of course, that ammonia smell. They have belchings and flatulence. Much time? Okay, I got time. Belching and flatulence, so there's a lot of nausea. So that's that colic, a lot of nauseating, uh, burping and farting and nausea in the morning. They vomit food mixed with bile, so that's from the liver, the bile coming up, and a slimy matter after diarrhea and of bile. So they have diarrhea and bile in their diarrhea, bile they're throwing it up with their food, and uh, slimy matter after diarrhea and of bile and fecal matter. I don't know why fecal matter is there. That's got to be they're throwing up fecal matter and bile. That's got to be what that is. I might have miswrote that when I did that. But there's, we're talking the stomach. We're not talking the rectum. So this has got to be fecal matter and bile coming out when they vomit their food, and it's slimy, and especially after diarrhea, they have that. So they have diarrhea, and they're vomiting their food with bile and fecal matter coming out. Okay, throat is rough with hawking. So they're hawking up that mucus that is hard to detach. Where am I at? Copious, tenacious mucus. So lots of it. Abundant secretion of mucus. So there's a lot of mucus coming out of the throat, and there's that whitish fluid coming out of the nostrils, and they have in vertigo in forehead with confusion followed by aching in temples. So they'll have this vertigo with confusion and aching in temples, like, where am I? What's going on? They sort of pass out almost. Uh, but this is great for urine. Of course, you should, it's like almost a doctrine of signatures. You eat asparagus and your urine smells like ammonia. So there's a lot of urine stuff, a lot of heart stuff, a lot of there's rheumatic pains going on, fluid retention, a lot of anxiety, with all this stuff. So that would be asparagus. And like I said, mes- Asimina triloba, that is pawpaw, is good for uh, tonsils and saliva glands enlarged, fever, vomiting, scarlet eruptions on the skin. So that would be, that could be any kind. That could be scarlet fever. That could be a flu. That could be a cold and pneumonia. Your throat gets sore, and they got hoarseness and laryngitis. Like I said, being in this area, my mother has hoarseness. My wife don't have it, but it could be a good medicine. God always sticks them plants right in the area where you'll have them problems. And an Asclepius Vincentoxicum is good for diabetes, good, again, fluid retention, and with great thirst and profuse urination. Oh, and let's go through so that was swallowwort, American pawpaw, and asparagus. And at the end of asparagus, there is nothing to read. Okay, so frequent urination with fine stinging and meatus, that's the penis, followed by stitches out of the urethra. After urinating, burning in urethra with sensation as if some were still passing. So it always feels like there's something in there. Increased urine, and it's beer brine, or turbid, as they said, without sediment. Urine is strong smelling, odor peculiar, deposits greasy sediment out of sides of vessels with gravel. Severe coryza and nasal catarrh. So a lot of mucus in the nasal and the throat, basically, with profuse secretion of thin whitish fluid from left nostril, and then afterward, like I said, right nostril. Frequent violent sneezing, and there's a few of them that have that. Medicines: copious discharge of tenacious mucus from the throat, not easily loosed. So Calibic has that. Hepersulf can have that, but Calibic's a big one. You really fight to get the mucus out with Calibic, but Calibic's mucus is quite yellow and thick. But they both of them have a hard time hawking up that mucus, brought up by hawking or coughing. It causes weakness and cardiac depression with dropsy. So a lot of fluid retention with cardiac problems, rheumatic pains, especially about left shoulder and heart. Fullness of chest, hydrothorax, which is fluid inflammation and fluid retention with that. Uh, yeah, inflammation and fluid buildup in the chest. That's what hydrothorax is. Visible violent palpitations while sitting with anxious restlessness, increased by motion or ascending with oppression of chest. So sitting, they have that. They start moving, it gets worse, and going up an incline is even worse. Pulse is weak, slow, and irregular. And then pain in left acromion. And that is a point right here. And I do have that. So I'm not even looking at asparagus because it may be the medicine I need for that. Because my shoulder, and then I hit a spot down in my scapula, my shoulder blade, and that shoots up in there and relieves it. So yeah, I use shiatsu to kind of get through whatever, and that's only from whenever I do a lot of lifting and stuff. So pain in left acromion process under clavicle, which is that shoulder blade, and down left arm, and that's basically what I get. I might want to. I don't have asparagus. I don't know. I can get it probably $10, and then I'd have it for a long time. I've got these medicines that I have for like 30 years now, and I'm still using them, and they're still good. Constant desire to be carried about in arms. That sounds like chamomile there on that one. That's a chamomile symptom. They want to be carried about, and then you put them down and they start crying again. They don't know what they want. That's all chamomile. But asparagus has that symptom too. So asparagus is good for, like I said, rheumatic stuff, heart stuff, urinary stuff, a lot of anxiety going on, and especially the urine stuff, the smell of the urine and all that kind of thing, stitches in the urethra, a lot of things there. But yeah, those are the three medicines: pawpaw and swallowwort and asparagus today. Tomorrow's is aspen, which is a Bach flower remedy. Join me tomorrow to figure out what a Bach flower remedy is. You can age, but you don't have to get old.